Hey guys, it's Nikita. I just wanted to give you guys an update. I had my tummy tuck consultation today with Dr. Stewart in Charleston, West Virginia. I was going to see if he would allow me to record my consultation so I could upload that for you all, but they did not allow that in their office, so I was not able to. However, I do have some exciting information to share with you all. Started out when I went in, I had to do the paperwork, just asking me about any illnesses, any surgeries, things like that. And then when I was called back in, he came in and introduced himself, very mannerly, very polite. I had to change into like a hospital robe or gown, whatever it's called. I had to change into one of those. He came back in after that and took a look at me. He was asking me what type of overall outcome of a result that I would like. And, I just told him I have a lot of skin. I explained my story to him. I have 4 kids, 4 C-sections, weight ups and downs, but I'm out of weight now. I'm not going to say that I'm not happy with it. I mean, I'm comfortable, but I would like to lose more slowly. Like, I'm not in a big rush to lose a bunch of weight. I have been dieting, and I've lost a couple pounds. I've actually been only eating soup for, like, the past 2 weeks, and I've lost 5 pounds. So, I mean, if it continues like that, then that's really good. Only thing is if I can stick to the diet, because I'm not very good at it. I like food. But anyway, back to what we were talking about. I told him I just wanted the skin gone. I was tired of the hanging over and the muffin top and just not being able to wear jeans and certain clothing comfortably without a big roll of skin hanging over. He listened to everything that I had to say. And then I undid my gown, and he was looking at everything. He had me do certain exercises, like he would have me suck in as far as I could, blow out as hard as I could, just to see how much skin we were working with. He told me that basically I would be having a full tummy tuck with lipo, muscle repair, and the good thing about it is I was really, really excited when he gave me the quote price. I was expecting to pay at least $10,000. But luckily for me, there will be no hospital fee. He does not do his at the hospital. He has like an OR room that he has in his office, and it's equipped with everything that the hospital would have in order for you to have the surgery. And his anesthesiologist works for the local hospital, so they come in. Now the anesthesia, I will not have a tube going down my throat. It'll be an IV anesthetic. He said that it could take up to 4 hours. Once the IV is put in and the medication starts dripping, you're asleep within 90 seconds. After the surgery is complete, they remove the IV and you wake up within 7 minutes after. But yeah, there's no hospital fee, so I got a really good price. That was the thing that was worrying me the most, because I was expecting it to be outrageous or something that I couldn't afford to do as soon as possible or as soon as I'd like, which is after the beginning of the year. But I'm very pleased with the price. I'll get to that in a minute and talk to you guys about the price and everything. I just want to go more into detail on everything that we talked about. He showed me before and after pictures of patients that he's operated on who were similar, but not exactly the same, but were similarly built like I was, or like I am. There was one photo, and I swear it looked exactly like me. Like, once I'm undressed, I'm in the bathroom and getting ready to take a shower, if I was to look in the mirror, I would see the same thing that I seen in that picture. And the results to that picture and all the other pictures were absolutely amazing. I couldn't believe it. And I really, really, really think that I'm going to choose Dr. Stewart. I still have another consultation on the 3rd. So I'm still debating on whether to schedule a surgery date now or wait until after that. But I was very pleased with everything. I don't have to stay in a hospital. Once the surgery's done, he said that I'd have to be back the next day, where it's 2 hours away from home. There's a hotel close by, and a lot of his patients that are from out of town stay there to come back the following pre-op day to get their checkup. And he occasionally gives discounts to stay in that hotel, so that's probably what I'll do. But you're sent home the same day. He described to me that I would have to come in to a pre-op appointment, which would be around 2 weeks before the surgery date. There we would basically just talk more about what was going to happen, go into more detail about everything. They would give me my prescriptions for my painkillers and antibiotics. I'll have to take an antibiotic the night before and then after surgery. I think I gotta take them for like maybe 2 or 3 days after that, just to make sure that there's no infection. He showed me once he examined me. Let's see, I'll stand up and show you guys. Basically, ignore my house. It is a complete mess right now. I've had kids all weekend. Or all week, sorry. But, basically, this is my tummy. I wear my pants way up here because it kind of sucks me in a little. But this is my tummy right now. I mean, you can see I got a lot going on here. He basically told me that I would be cut from hip to hip. And he doesn't do lipo in this area because he says that there is increased in the skin dying because of the blood flow. Like, once this flap is lifted up while he's making the incision, it's just too risky for him to do lipo in this area. But he is going to do lipo throughout here to make it look flatter and get rid of some of that. Now, all my stretch marks, they come up to here. I don't know if you guys can see it. But he said basically he was going to cut on the inside of my belly button, remove about this much skin, so about from here down would be removed. And that's another thing he did. Like, he put his hand here, had me suck in, and he actually pulled down as I did that. But yeah, it'll be removed from here down. I may have just very few, very, very few light stretch marks up there. But, yeah, so basically that's what he told me I would be getting done. And, he had mentioned something about, after the skin is removed, he sits, I guess it's like a weight, he'll sit here to make sure, after he's tightened my muscles, he is going to do that. He's going to go in and suture my abdominal muscles back together where they've been separated during my pregnancies. But, yeah, after all that's done and he's getting ready to pull the skin down, he described it as like a compression weight. It's not like a garment. It doesn't go all the way around, but it does lay over you. And it mushes you from here down so he can get the tightest possible, remove as much skin as he possibly can, because that weight, it just presses in and pushes down, pushes all the skin downward. So if he needs to make more incisions to remove a little more after what he initially did, he can do that. I'll only have one drain. He does not put two in, and I talked to him about that also. Because I know some doctors do it, if you have it from hip to hip, some doctors will do it at the end of the incision on each hip. Some doctors do it in the pubic area, and most of the time you have two drains. He, however, only does one drain, and he does it in the middle here. The incision will be above the pubic line, and he had described to me that the one drain would be not placed in the pubic area, not placed on the side of my hips, but the one would be placed right above my pubic area, and it actually comes out the incision that he's already made. So there will not be another incision for the drain to go through. It'll already be through the incision that was already made during the tummy tuck. And I just thought that that was really neat, you know, because that way the scarring, he also mentioned a couple weeks after I'm post-op, he does scar management because he likes for his patients to have scars that are very, very lightly visible. And he said that we'd talk more about that after, or if I decided to go with him. And now I have up to 6 months to decide. And this quote that I was given today, it's good for 6 months. So, but anyway, I'll go ahead and get into that. Oh, and they gave me this cute little bag. It's got some little goodies in here. I'll show you. Let's see. Oh, and also, the consultation with him was $100. I don't know if you can see that. And they gave me a receipt for that and told me to bring this back once I schedule my surgery. And this will be reduced from my quote price. Now, this is my quote price. The abdominoplasty alone is $6,250. And then the anesthesia is $1,000. Procedures can be scheduled 2 to 3 months in advance. Please call at the earliest convenience to reserve your time. The quote consists of the surgeon's fee, anesthesia, supply cost, one garment. It also includes standard pre- and post-operative visits. Please quit. Go play. I'm doing my video right now. Prescription medication is the patient's responsibility. Touch-up or revisions will incur an additional charge. So, this is my price. And I am so happy. I don't know if you guys can see that. It's kind of blurry from where I'm sitting. Yep. Yes. I was just blown away by that. He gave me like a care credit. Just talks about care credit and the different types of plans they have. For anyone on here who is thinking of care credit, you all can look at that. I'm not going to do care credit because I have horrible credit. I'm going to be paying full price out of pocket after I get my tax return, but just in case that might be helpful to anyone else. And yeah, so it went really good. I'm very pleased with the before and after.